Hi, I'm Dr. Brad Jacobs. It's a pleasure to be here today. I'm a member of the Integrative Health Advisory Board for Pharmaca, and I'm going to talk about the benefits of yoga. As many of you know, yoga has been around for multi-millennia, over 5,000 years, and historically it was actually much more complex and made up of what we call the 8 limbs of yoga. Today we pretty much focus on one of those limbs, which is the asanas, or the postures, the physical sort of positions of the body, but really it's made up of multiple aspects. And some of you may have experienced yoga where they bring in breathing techniques, for example, in areas of focus and meditation that use both the mind as well as the body. And I like to think of yoga as really in that light, as well as the concept that yoga sits within a larger construct of Ayurvedic medicine. And Ayurvedic medicine has a full complex and complete medical system that involves lifestyle that includes yoga as one facet of it, as well as herbs, as well as many other pieces. But to focus just on yoga and the health benefits of yoga, there's been science looking at this for over 100 years. Most recently now we're employing randomized controlled clinical trials to look at yoga. And some of the most interesting ones have looked at things such as high blood pressure, depression, back pain, to just start. Also, some of the ones you might imagine would be effective, such as stress and other factors such as that, have also been looked at. But to think about high blood pressure and that we're able to regulate high blood pressure through the use of yoga is quite interesting. There's been many studies looking at this, starting back in the 1970s. And they found that yoga actually does shift people's blood pressure for the better, and improvements in regulating blood pressure. Some people have been able to come off medications altogether, and other people have been able to lower the dose of their medication through using yoga as an additional therapeutic tool. If you think about back pain, there's been some more recent clinical research looking at back pain and the benefits of yoga for back pain. I personally have suffered from back pain for many years, and as a result, went to the literature to see if there's any randomized trials that show benefit of yoga for back pain. And back then, actually, there were none. But in the past 10 years, there's actually been at least 4 randomized controlled trials that have showed that yoga can be beneficial for back pain. The exact mechanism is a little bit unclear. It's thought to regulate potentially cortisol levels, which is really sort of a surrogate marker for stress levels. It's also thought to improve flexibility, particularly of the hamstrings and other large muscles that affect the back, and thereby affect low back pain. Some people believe it actually affects your ability to move through the world in a confident manner because you're in a controlled space. And by having a supervised teacher who's helping you do specific positions in a controlled fashion, you can then take that sort of skill and confidence and move into the world and move through space with less pain. Regardless, it's been shown to be effective, reduced pain and increase in function. The other thing to think about is depression and mood. To think that yoga might affect mood and affect depression is quite profound in my view. Much of that research has looked at pranayama, which is really a breathing practice that people use that are practicing yoga. And it's a specific breathing practice and specific breathing patterns. And that's been shown also to be beneficial and affect mood or depression. Some of the mechanisms, again, cortisol is also shown to be modulated through that research as well. So the exact mechanism is unclear, but what's quite interesting is that depression can be affected through yoga. And more globally, I think what's really important is that clearly people feel much better when they do yoga. I've become quite a big fan of yoga. I've seen people from all walks of life with all health conditions coming out on the other side of yoga class feeling relaxed, feeling like they're more vital, feeling like they're sleeping better, and really just generally happier. So I personally am a big fan of yoga. I think it's quite wonderful as a therapeutic drug, if you will, for multiple indications. And I recommend it to many of my patients. I will say some people do get injured doing yoga, and how to avoid that is very important. Number one, if you have medical conditions, you should talk to your yoga teacher about your medical conditions before the class. You should make sure you're going to a yoga teacher that is qualified, and there are national guidelines for qualifications, and there's an alliance that people can register to be part of a national alliance of yoga therapists. and I'd recommend that you go to a teacher that is part of that National Alliance, and that you look and see how much training they do have. Sometimes people are being certified in just a few hundred hours, when actually there's more like 500 and 2,000 hour training certifications that I think are much more beneficial, because those folks have much greater training, they understand anatomy and potentially also medical conditions. So be very careful about the yoga teacher you choose and the yoga school that you select, and be mindful that it can be quite beneficial, and just be wary of getting injured while you're doing it. But overall, I think it's a wonderful therapy to consider.